Thank you so much. I'm here. I'm a nurse with 25 years worth of cardiac rehab experience, but I'm also a nurse with 34 years worth of nursing experience. So I come from a background that includes psychiatry and critical care. So I think it was kind of natural that I ended up in cardiac rehab. I work at Our Lady of Lourdes Medical Center, which is actually located in Camden, New Jersey. And we have an outpatient cardiac rehab center in Cherry Hill. And Cherry Hill is a very nice suburb of Camden and has been a very successful startup for us. So in terms of my hospital commercial, we're very well respected in the area. We have a robust cardiac program. We are a leader in market share, and our competitors include Philadelphia hospitals like the University of Pennsylvania and Jefferson. We were recently recognized in the New York Times for an article regarding our door-to-balloon time. So we have a very, very strong support system. And what has resulted in all this is we have a gigantic pipeline filled with patients for cardiac rehab. And I have a cardiac rehab center that's in Cherry Hill, which is a huge building. I would compare it to the Mercedes-Benz Superdome. And the cardiac rehab center is about the size of the locker room inside that dome. So we have plenty of people to come in, but we don't have a lot of space. So what happens? We have patients that are waiting 8 weeks to get into our program. I have physicians that are upset with us. I have patients that are mad that they can't get in quicker. I have staff that are very dissatisfied. And we have tried 3 different attempts to expand the footprint of our cardiac rehab program in that beautiful building. And short of bringing in a sledgehammer ourselves, which one of my staff members has offered to do, we have been unable to expand our footprint. So we were looking for a more innovative approach in a way that we could reach more of our patients. So I can't tell you how many people told me, Maryann, this is a good problem to have. You have so many patients and you have such a long waiting list. And I would think to myself, and I would think, you know what? A good problem to have would be, I have so many diamond earrings to wear, I can't decide which pair to wear to work today. To me, that's a good problem to have. So we started our pilot in mid-June, and the way that we work it is we have patients come into cardiac rehab for 3 weeks. They get the standard pre-training, which is education and exercise. And if the patient is interested, we have the ability to lend them a Fitbit, a tablet, if they don't have a smartphone, and a blood pressure cuff. And we also ask, of course, that they return all these things to us at the end. So I did mention that I work for a Catholic hospital, right? So we really emphasize that thou shalt not steal. So once we select our patients who are low to moderate according to AACVPR guidelines, the patient really has to want to do it. We have offered it to some patients who we thought were really great candidates for it, but they would say, no, I don't want to do it, or it's okay, I want to keep coming, I really don't want to. Because what we do is we have them exercise twice a week at home using the app, and we have them come into cardiac rehab 1 time a week, where the nurses are really focusing on their goals, what we want them to do within the next week, and providing them all kinds of information. So we've realized that the patient really doesn't need to be tech savvy to do this, but they do need to be interested, of course, okay? And I've already explained the equipment that's offered. In terms of how this supports us with our educational goals, even though patients come to something akin to what we've heard about group orientation today. There are also targeted risk factor modifications for those patients with AHA videos that the patients can watch. And we also get feedback, and we know if they've watched them or not, okay? And then they can also do some routine things, like they can fill out their PHQ and rate your plate on their time. So there have been quite a few challenges implementing this program. We are not charging patients to participate in this program. We're not charging insurance providers for patients to participate in this program. So you can imagine the response that I had when I went to hospital administration and explained that I wanted to do something that might actually cost money initially, but would save money at the end. So thus far, we have 5 patients that have been enrolled in the program. As a matter of fact, yesterday, our public relations department was in Cherry Hill with a film crew, and they were interviewing one of the people who was participating in it. Next week, I'll be rolling out a presentation to the cardiologists. I have 82 cardiologists that are co-managed by the hospital, and I'll be speaking in a room not quite as grand as this one, but I'll be explaining the program to them and also encouraging them to start thinking about the kind of patients that they're referring to cardiac rehab, because in many cases, people that are going back to work, the physician may mention cardiac rehab, but the patient will say, oh, there's no way my boss will give me off 3 times a week to come. So we want to kind of expand their ability. And we kind of did a soft opening in the middle of June so that we enrolled 2 patients at a time, so that the staff had time to work with the dashboard that you saw earlier, and so that we were familiar with how to explain things to the patient. So there's a chat function on this, and some of the chats have been quite humorous. But I would say that our more chatty patients are the ones who participate in this chat function. The patients are telling us that it's easy to use, and I would say that of the people that we've offered this to, I would say our younger participants are the ones that are jumping on it right now. However, I have not offered this to an engineer yet. So our next steps, we're going to increase the number of our participants to 10. Of course, we're keeping a close eye on the bundled payment. I want us to serve as a model for other Trinity cardiac rehab programs, but of course, in the greater scheme of things, I would like us to serve as a model for all cardiac rehab. And we want to improve all the metrics related to quality care, the readmission rates, patient satisfaction, the financial benchmarks, and the care coordination. And thank you very much.